Ladies and gentlemen, my name is George. I'm here to present medication errors and risk reduction to Woodstock Nursing and Rehab Center. I'll move ahead to the definition. Medication errors are preventable events that may cause or lead to inappropriate use of medication that may cause harm to the consumer or to the patient. We have types of medication errors. One is giving wrong dose. Giving wrong dose means the dose of 20 milligram of omeprazole was ordered. You gave 40 or 10. Wrong calculation issues also is another error. This is common with the drips, which we don't have a lot in the facility or any in the facility at the particular point. Giving wrong medication to a wrong patient or giving a medication to a wrong patient, that's another form of medication error. Giving wrong strength, I also mentioned that in at the beginning. Another area where we can find medication errors is delivery issues. Pharmacy not delivering medication at the right time or delivering medication with the wrong dose. So as nurses, we just have to be careful and watch what we are giving to our patient. Our main goal is to keep our patients safe and free of harm. Why is medication error a big issue, especially here in the United States? First, medication errors can lead to death. Another one is it can lead to morbidity and mortality. It can lead to prolonged hospitalization, whereby this will be treating adverse reaction from a medication error rather than teaching the actual problem which the patient presented when she or he was admitted. It also leads to increased medical expenses as to the facility and to the patient themselves. Other factors which can lead to medication errors are omission of the dose, and this is very common. Most of the time we nurses, we tend to be busy, or we are actually busy and we fail to check our charts during a 24-hour chart review, and by that you can miss an order or miss the only prescription written by the doctor, and that will also lead to medication error in that the patient will not get the prescribed medication at the right time. Calculation, I mentioned. Transcribing orders. The doctor wrote an order, the nurse who is transcribing the order to medical administration record did not transcribe it as it was written. Another point is not following 6 rights of medication, which I mentioned earlier as well. Not being able to read what the doctor wrote, and you assume, okay, this might be what the doctor wanted to write or what the doctor wrote actually. Another factor which is common here at Woodstock Nursing and Rehab is the distraction of a nurse during medication administration process. This can happen, another staff trying to get the attention of the nurse. The nurse has already pulled the medication and are about to administer. She forgets about everything and ends up giving medication to a wrong patient, or giving the right patient the wrong medication. So we are being advised to avoid unnecessary conversation which may draw our attention away from what we are doing. Lack of in-service and training. I remember, I think at Woodstock here, the pharmacies always send a representative maybe once in a month, if I'm not wrong. But we need to be doing this on regular basis to keep track of what medication we are really giving to our patients. Research suggests that we should have increased pharmacological knowledge of the medication. That should be the duty of the nurse and whoever is administering the medication. So we just need to be familiar with what we are giving and why are we giving it, and teach our patients accordingly about their medications. I did mention an adherence to 6 rights, 24-hour chat checks I also mentioned. Another thing which might result to medication error is work overload. One nurse assigned to 29 patients, you are trying to get to each of these patients and trying to give them their medication at the right time. That's really a challenge, and I would suggest that the facility or the staffing coordinator ensure that we have enough nurses to care for our patients. We'll proceed to talk about changes needed, like what we have to do to avoid these medication errors and ensure patient safety. We'll start by talking about nurses as a nurse, you should not give a prescription which you did not prepare. By that I mean do not administer a medication which was prepared by the other nurse, because you really don't know what it is or what is in there. That's one way to avoid medication errors. Giving medication at the right time. I mentioned earlier about antibiotics. Antibiotics, we want to maintain that therapeutic level. So give them as ordered, as the orders say. If it's 8 a.m., 8 p.m., ensure you give it within that window frame of 1 hour before, 1 hour after. Another thing which will help us reduce number of medication errors is we need to report any incident of a medication errors, especially to the facility, so that the necessary action needs to be taken, and any change that needs to be done is done at the appropriate time. We need to follow urgency policy. Like here in Woodstock, we give a Coumadin and such medication which needs PT and INR levels. So the facility says range is between 1.89 to 2.88. That's normal level. So as nurses, we should be aware of that. Another thing, we need to check for patient allergy to the medication, because we don't want any reaction from giving a wrong medication to the patient. Another thing we can do to reduce this risk is having two nurses. For example, when you are administering insulin, you need to double check with another nurse to ensure you have the right amount. Another action plan that we need to put in place is the facility should adopt the use of computer medication administration. Here where we'll make use of barcoding, like scanning codes, scanning the patient armband, and scanning the medication before you give it. And the research has proved that that has really worked in reducing the number of incidences of medication errors. We need to be aware, we need to watch for medication with the sound alike names. For example, the doctor ordered Zantac, which is an acid reflux medication, and Zantac and Zytec. Zantac is an acid reflux medication, Zytec is an allergy medication. We need to be aware of those, so we ensure we don't give we ensure we give the right medication. Communication is another key, and communication is what runs everything in nursing. Communicate with your doctor, your pharmacy. If you are not sure of anything, call the doctor. If you are not have a question about anything, call your pharmacy to double check with them before you do harm to the patient. We talk of 6 rights of medication. These are right patient, right medication, right route, right dose, right order, and right documentation. I know everybody here is pretty much aware of that, and we just need to put it into practice. We talked of continuous education. So, as nurses, why am I presenting this program, this project to you guys? Like, how will it make us better nurses? First of all, I will feel happy and confident about what I'm doing if every time I work I ensure everything is done according to how it's supposed to be done. For example, whenever I work, I ensure I don't have any error as far as medication errors is concerned. Working as a team with other team members, like we are here right now, trying to understand why we should avoid these errors as much as possible. That's also the reason why I'm here presenting this, and it will also improve the facility image. You know, the surveyors, when they come, the first thing they look for is, okay, where they look for loopholes, the errors, where we have errors. And you know, like last month, last few months down, they did a survey here. They never found anything, and that was a plus. And that's what we want to maintain. Also, just not having any medication error it's something it makes you working to improve your standard of healthcare delivery. It makes you feel confident about yourself, like you know what you're doing, and you also want to help others do the same. And what are the results of all this medication error we are talking about? First of all, we talk about death. We don't want our patient die unexpected death or unavoidable death. We want to keep our patients safe at all cost. And we want to also cut the cost of healthcare for them as well, and for the facility as a whole. Yeah, I think I'll end there for now, and I really appreciate you guys joining the team.
I have a question.
Ask your question.
So if, for example, I take a wrong dose today and I'm feeling sick, who do I call? Do I call the nurse or I go to the hospital?
If you take a wrong dose today and you feel sick, tomorrow or today?
Today, yeah.
That's what we've been talking about here. The first thing you do, report it to your nurse or anybody around you. Call for help. So there are some which we can treat within giving an antidote to the medication you've been given. Or if it is you're having adverse reactions, you will have to send you to the ER for that. And those are some of the things we want to avoid. We talk of expenses. In your part, in the part of the facility, and nobody wants to go to the hospital for somebody else's error. Yes. Any question? Thank you very much for coming. God bless. Let's continue to keep our patients safe. Thank you.